Hi, everyone. Thank you for joining us on June 26th at 8 p.m. Eastern Time. I'm joined by Cindy Wasser of Hope Springs Fertility Law and Dr. Librach from Create Fertility Center. And tonight we are hoping to answer your questions and to provide a little bit of insight into surrogacy in Canada and the availability for abortions during a surrogacy. It is not a topic that is easy for any of us to discuss, and we have all grieved in our own ways over the last couple of days with this news. And for me, it was so important that I had this opportunity with experts to share their knowledge and expertise on this topic from a legal perspective as well as a medical perspective. So Dr. Librach, if you would like to talk a little bit about your experience, how long have you been a fertility doctor and OBGYN, and what you've seen in terms of the unfortunate times that termination does come up?
So I've been doing REI fertility for about 30 years now. I trained actually at the University of California, San Francisco many years ago and came back to Canada. We now have the largest fertility clinic in Canada and by far the largest third-party program. So we really have a huge infrastructure for caring for patients with third-party. And so would you like me to talk now about like details related to this issue or just talk?
Yeah, absolutely. So I've gotten lots of questions today from people who are saying, well, we're deciding between a surrogate in Canada and the US, and given these new laws, and what are the laws in Canada around termination? And if we were intended parents who would make that difficult decision, is it possible to in Canada?
Yeah, so I can answer that from a medical side. I'm not a lawyer, of course, but we have Cindy here to talk about that. But basically, there's really no restriction on termination. Generally, terminations can be done up to about 24 weeks, and that's when doctors are willing to do it just for social reasons. But if we're talking about for a problem where there's a severe abnormality in the baby, it can really be done at any time during the pregnancy. But normally we do discover these things much earlier in the pregnancy, so it's rare to have to do a termination after 24 weeks. So generally, you can find things in the first trimester or early second trimester, and you'll know there's a severe abnormality that can be terminated. And if there's a situation where that would be the choice of the intended parents to have a termination, just try again, basically. And we monitor our pregnancies in the first trimester very closely. So it's not like a lot of fertility clinics will just kind of see them, they're pregnant, and then they send them off. But we carefully monitor our pregnancies in the first trimester, make sure they get off to a good start, and that if there are problems, we can help them deal with those problems. I think the other thing that is great about Canada is that if you do decide that you'd like to move embryos here because you'd like to have a surrogate in Canada because you've made your embryos somewhere else, there's no restriction on transporting embryos from another country to Canada, as long as that's feasible from the other country and releasing the embryos. That would be different in some countries, but most countries, and the US is not a problem at all, where you can move embryos to Canada, and we can certainly help people have children that way by transferring those embryos to a surrogate. So that's
Sorry, I just want to stop you there. So for those of you who sent me the question that you are working with a clinic that's had the trigger law yesterday on Friday, and physicians there will not be able to suggest termination or even be sort of a part of that in any way, and you have embryos in that state, what Dr. Librach is saying is that you are able to move those embryos to Canada and proceed with your surrogate that you already have through our agency or another agency, as many people ask that question. Or if you had embryos and were considering surrogacy in that state or within Canada, Dr. Librach can receive those embryos, and we can absolutely have a surrogate continue screening in Canada as opposed to your clinic in Utah. So that was that answer. Sorry, go ahead, Dr. Librach.
Yeah, absolutely. I think that there's a concern out there regarding how this would affect IVF, not just the termination question. And that is that if it's changed that the definition of life starts at the time of conception, there may be some concern that, embryos will be considered that. And therefore, if you don't want any more children at a certain point and you would like to discard the rest of the embryos, there may be a problem with that. And I think that's one of the concerns that people have is that, will there be restrictions on how many embryos you can actually make and not have excess embryos, which is good to have if you want to have more tries and transfers for future children. You want to make sure there's enough embryos there to complete your family. So I think that's an important thing that people are concerned about. And of course, we don't know what's going to happen, but there is talk about that potential, especially in certain states.
One of the other questions I had, Dr. Librach, was if a surrogate were to have an ectopic pregnancy or a missed miscarriage or an issue with a sort of a pregnancy remaining that wasn't viable, is that an abortion? Is that DNC, considered an abortion here in Canada in the same way that it is in the US?
Not at all. And so if there's ever a non-viable pregnancy, we can perform a DNC without any difficulty at all. That's between the doctor and their patient, and there's absolutely no problem at all.
Okay, thank you. And then the last question that I had was interesting, and I don't know if this has been answered in the media yet or around these new laws, but it was that, intended parents have a specific genetic issue and they want to do PGD or PGTA on their embryos. And it appears that their clinic in the US has said right now they're halting that, again, in a trigger state until they have more information. And so, these are American clients. And Cindy, I'm going to get you to answer this one and then back to Dr. Librach. But they are concerned that because they reside in a state that it is now, this is completely illegal. If they come to Canada for a surrogate and do such things that would be illegal there, are they safe?
Okay, so the legal question is, can I do something in Canada that is legal where it is illegal where I live in whatever state or country?
Correct.
So the answer is yes, you can. So for example, with a simple rule, like you can smoke marijuana here, it's legal now, and you can come to Canada and smoke marijuana and go back to the US in a state where it's not, you won't be arrested. So one of the things I'd like to see Canada do with respect to this issue, and I suspect it's being discussed right now, is considering ways in which we will support and protect anyone who does need to come here for termination, who might fear prosecution when they go back home. At the moment, they do not have the crimes in place, the legislation in place that will make it criminal to go somewhere else for the abortion. But there's talk about it. And one of the pieces that impedes them from doing it is that transportation is a constitutional issue in the United States that also involves commerce. So how they would word it to stop a pregnant person moving for an abortion versus a truck with goods is challenging. But that doesn't mean that they're not working hard on it. That right-wing team is working a lot harder than the other people who should be.
So US people in a state that has said no way, they would be able to come to Canada, have a Canadian surrogate, and if they were required to terminate, they could.
Yeah, and I'd like to say if any agency or fertility doctor wishes to sign a retainer agreement with Hope Springs Fertility Law, it will be my honor and privilege to offer pro bono legal advice during which we can have a confidential and privileged conversation to help any patient or client in that agency, or for any other lawyer to discuss with me in the potential of having a discussion about a particular person whose needs need to be met medically and safely. And that will be my privilege to do that pro bono, no fees.
Oh, thank you. Thank you, Cindy. That's amazing. I want to sort of switch gears and just, Dr. Librach, you mentioned you have the largest clinic. I know you have a staff of, I want to say 5 counselors / therapists available. And I really want to talk a little bit about people who are facing this, people who maybe have terminated in the past and are feeling this heaviness and shame and, as though they participated in something that wasn't illegal then, but is now. I want to sort of talk about when termination does, is required. Dr. Librach, I know your team does a really great job of providing counseling, not only to the gestational carrier or to the birthing person, but to their partner, to, in the case of surrogacy, which is what we're talking about, to the intended parents. And I'm wondering if you can talk a little bit about how you have over 30 years been able to sort of manage that with people to ensure that they feel like this is a safe option for them.
Well, we always try to be there for them because, that's a very difficult situation for both the surrogate and the intended parents, of course. And so we try to make sure that they find a place where it can be done, where they can terminate the pregnancy, and try to offer counseling for them to, to overcome the grief of that, which is a horrible thing to go through, of course. But I think that the key is that we want to support them in any way we can to make sure they get through that in the most emotionally stable way possible, so that we can move on and try again the next time. And over the years, we've never ever had a problem where there was a situation like this. Luckily, it doesn't happen very often, but when it has happened, we've never had a problem to complete the pregnancy termination and move on to the next step.
And on that topic, I know that there's also these questions of, birthing people having to access unsafe abortions and having to, fly the same day that they have a termination, and, sort of all these unsafe situations that people are being placed in. And I'm wondering if you can talk a little bit about the research that your clinic has, I want to say, spearheaded on after a termination and testing of, I want to say, fetus material. I'm not sure what the right word is, but if you could sort of just talk a little bit about that, because I think it's important when you have to terminate to go, is this going to happen again and again and again? Or how do you know that it will or won't?
Yeah, so the key is if we can find a reason why it's happening. We have one of the top genetics labs in the world to test embryos here at CREATE. We published a paper in the New England Journal of Medicine recently. So we really at a very high level. And so we can really look at so many different genes and factors that cause miscarriages or failures of implantation or an abnormal fetus. So we really have the ability to do that. And if a pregnancy is terminated or miscarried, we can test the tissue and analyze what happened to try and see if there's something we can prevent in the future.
Okay. Excellent. That's great. And we've had surrogates together that have faced this, that have had to terminate, whether it's an ectopic pregnancy or whether it's a joint decision because of an abnormality or whatever the case is. And, I've really appreciated the supportive care that you've offered to people and that the other doctors within your clinic have. Yeah. And so, Cindy, I'd love for you to talk a little bit about.
One more thing before we go.
Oh, sorry.
I want to also mention it's very rare that a selective reduction needs to be done to try to reduce the number of babies in the uterus to a safer level, because sometimes embryos split, or we don't do too many double embryo transfers anymore, luckily. But if that ever happens, in another clinic, for example, we can offer the service of doing selective reduction to help to make the pregnancy safer for the surrogate and have better chance of healthy children at the end. So it's just another sort of aspect that we can help care for in those very rare situations.
And that's important too, because under these new state legislative reforms, selective reduction will be considered a murder or an abortion of some sort, so they can't do them.
And I also wonder if they're going to restrict in some states being able to do genetic testing, as you mentioned before.
I believe so, because they would consider, if the state considers life at conception, as you mentioned earlier, Dr. Librach, then testing on a human being it'd be the same effect. It would be considered unethical, torture, illegal, a whole slew of things, like testing on us. You wouldn't do it.
Because ultimately we want to prevent this from happening.
Anything that might destroy the potential growth of the embryo will be considered murder. And it's a state murder, so the president cannot issue any kind of pardon for state crimes.
So we are going to on our social platforms, and we'll be sharing with Cindy and with Create. We're going to share resources on how to connect, obviously, with Cindy if you're considering surrogacy, how to connect with Dr. Librach's clinic. If you have embryos somewhere and you're wanting to figure out how to get them here, or you're wanting to begin the surrogacy process. This really sort of quick chat was just, for me, a place to catch up with some professionals around this issue, and to offer our support, and for those of you watching to know there is such a safe place here in Canada, and we're so grateful to live in a country.
Just to illustrate another example, we've received embryos from Ukraine now, and they have pregnancies going with those embryos. Obviously, there's obvious reasons they would transfer the embryos out of there. So anywhere in the world, we can really accept the embryos.
Yeah. And I think people should know that our government really supports this. Our Prime Minister has spoken out quite well about the outrage, and our ministers. It's been about 30 years since abortion was uttered in our Parliament, but now they're uttering it with disdain of what's happening. There's already funding going for abortion clinics in Canada, because we might expect many people from the US to come through, particularly from the mid-states and from the Midwest states and up to the Midwest of Canada. So there's discussion between the Minister of Security and Border Patrol about allowing people who need abortions to come in easily without going through lots of problems at customs, feeling nervous. So our government is making it clear, and more discussion will be publicized in the next few days about how we will support anyone who needs this valuable service. And it's a constitutional right in Canada. It is safe.
People are also worried about the slippery slope. Will this then go to same-sex marriage, which in Canada is one of the first countries in the world to legalize that? So will that happen in the States? And how would that affect same-sex couples when they want to have children?
Yeah, and all of those are constitutional protections now, because our charter is a living document that grows like a tree. And I also want to point out, because I'm proud of our country, we are the only country in the world that has zero criminal restrictions surrounding abortion. Zero.
Absolutely. And I think regardless of what side of this topic, I'm not going to call it an argument, but this topic that you're on, until you are faced with an unplanned pregnancy, and until you have a gestational carrier that you're working with who's faced with an unplanned pregnancy, it's really difficult to know what you would do. And so for us, it's really important that people have the option. It's not saying, come to Canada, get a surrogate pregnant, change your mind. Come to Canada, find out it's a girl, change your mind. It's a very different thoughtful process here. But having that option, should you need to exercise it, is in my view vital. Having been a surrogate and knowing that I would not be comfortable carrying a child that was going to be born unwell or to pass away, I would want to have my intended parents and myself to be able to have those conversations, to work with a clinic that has therapy associated and a part of it, so that it isn't a shameful hidden secret, that it is something that is unfortunate and sad and devastating, but with support, knowing that healing is on the other side of it. So thank you, Dr. Librach.
As a parent who had surrogates, I can tell you that the choice of A, having an egg donor, and B, a surrogate, was so that we would have healthy children without any risk, or with such limited risk, that I chose surrogates who would agree to terminate if it was required for medical reasons. And to have that taken away from me would be crushing, I think, to most parents and the surrogate. So I wouldn't want to go through the process only to find out that I would lose that ability and that choice or right later on.
No, absolutely. Well, thank you, Dr. Librach. Thank you, Cindy. All participants will be sending you a copy of this, but we'll also be sending resources along. And if any of the information shared today was difficult or triggering, please reach out directly through the email this was sent to you at, and we will connect you with a therapist in your community to discuss it, as this is important stuff and it's heavy. So thank you so much for joining us tonight, and we will speak to you soon.
Good night, everyone. Thank you, Leah.